Hello. Hi. Dr. Philip Williams here. Just giving it a second. Dr. Philip Williams here, orthopedic sports surgeon. Hello, everybody. Dr. Philip Williams, orthopedic sports surgeon in Houston, Texas. I specialize in shoulder, hip, and knee athletic injuries, and I'm just coming in here to answer questions and give an idea of what my life is like as an orthopedic sports surgeon and give some insight on some of the disorders that I treat and the injuries that I see on a regular basis and how to treat them and how to prevent them and how to get you feeling good. So, just going to give it a minute to get started. Thank you for joining me so far, Shelly M3. I see you here. Thank you for joining. Look forward to talking and getting your questions. Feel free to send me your questions, and I'll do my best to answer as many as possible. And if I don't get to your question, feel free to shoot me a DM and I'll try to get to your questions. Just going to give it a minute for folks to kind of get in and get more questions so we can start answering. And I will get to it very shortly. So thank you, everybody, for showing up. And we will get started very soon. And I will start answering questions. But first, just giving a quick overview of what I do. I take care of competitive athletes, recreational athletes, and professional athletes after they get injured or before they get injured, hopefully, to try to keep them healthy and playing their best and maintaining a healthy lifestyle. And so thank you, everybody, for showing up. But I will get started. And again, if I miss some of your questions, because sometimes I'm not able to get to all your comments, I will be sure to try to answer any DMs or comments that you leave on my page. So just to get things started, user some number asks, how do I fix sharp shoulder pain when I lift something? Hard to know exactly what pain that you're referring to, but in general, when people have pain in their shoulders with lifting, it's usually from overhead activities, and that usually can be a result of some rotator cuff issues. Sometimes the labrum, which is one of the stabilizing aspects of the shoulder, can get affected with lifting heavy weights, and that usually requires physical therapy to basically compensate for the muscles that are injured or the structures that are damaged. So it can be either rotator cuff issues or a labrum issue if you have lifting issues with your shoulder. So thank you for the question. I will keep moving on here. Uh, Bucci asks, any way to strengthen my hip flexors? So again, I'm not a physical therapist, so I can't give you specific exercises for every single disorder, but for hip flexor exercises, basically stretching and strengthening muscles around the hip, mostly the core as well. But a lot of people, I would say, do not pay enough attention to the core musculature because a lot of the hip flexors are actually deep muscles that go behind the hip, and the core musculature is very important to work on hip issues. Thank you for the question, though. Tyler asks, what route did you take? I just earned my bachelor's in kinesiology. So, congratulations on your kinesiology degree. Personally, I did not take a standard route to orthopedic surgery or medicine in general. Just quick story for me, I was a political science major at Yale, and I worked on Wall Street for a little bit. Then after that, I ended up doing some research at Johns Hopkins, and then I went to Harvard Medical School for medical school, and then I did my orthopedic residency in New York City. So you can really take a non-standard route for medicine, and it's really kind of an interesting course if you kind of go the non-standard route, in my opinion. But congrats on your degree. Tyler Hinton 01 says torn ACL. I guess you're asking about what to do about a torn ACL. So torn ACL, the ACL is a very important structure in the knee. It is the primary stabilizer of the knee, keeps the knee from moving forward, and usually is important for a lot of cutting activities. So if you do a lot of cutting activities in sports like basketball, football, and other activities that require quick change of direction, in order a good ACL is necessary. So if you have a torn ACL and instability in your knee, that usually requires surgery, which is pretty reliably at getting yourself back to sports. Thanks for your question. So just going to skip around, and if I miss your question, send me a DM. Uh, so Vincent, you said I really had bad plantar fasciitis at 16 and can't play football because of it. Please give me advice. So usually plantar fasciitis is due to basically tight tissue in the sole of your feet, and stretching is very important for that. And custom made orthotics is very helpful as well. And if that doesn't work, sometimes an injection can give you some temporary relief, and sometimes a release of the plantar fascia by a foot and ankle surgeon can help with that. So Mads asks, do you recommend massage therapy for athletes? I really recommend any sort of modality that really helps with pain. You have to be careful with very significant manipulation of any joint, in my opinion, but massage therapy done correctly and judiciously can help with sore muscles and help for recovery if it is done by a very well-trained professional. Richard Rubio asks, what are ways to prevent ACL injuries? That's a great question. So ACL injuries usually happen from non-contact injuries, meaning that you are not necessarily hitting anybody when this happens. And it occurs because of basically the imbalance of forces around the knee and usually poor mechanics in the joint when you're cutting and pivoting. So the best way to prevent ACL injuries is actually to pay attention to how you are loading your knee and making sure that you are loading your knee in a very straight pattern and not basically getting your knee out of alignment when you jump or pivot and things like that, which is hard to do for a lot of people. So sometimes these injuries may be unavoidable in some instances. But the best you can do is basically strengthen your knee and work on your landing and jumping mechanics. So a lot of questions about ACL. Pilgrim 6578 asks, what's the fastest way to recover from ACL and meniscus surgery? The fastest way to recover from ACL and meniscus surgery is physical therapy, basically doing the prescribed physical therapy and working on strengthening and getting your range of motion back. It is a recovery that can take up to 9 months or longer for a lot of people, but if you pay attention to the protocols for the ACL and meniscus surgery, it usually is a very successful recovery. But bottom line is to follow the recommendations of your orthopedic surgeon and physical therapist. Thank you, Xavier Cole, for the rose. Another question about ACL. Mary Thacker asks, when can I go back to sports? I just had ACL surgery. Again, I usually tell patients about 9 months is almost the earliest that I would recommend ACL recovery because of the characteristics of the ACL on the recovery. So it may take up to 9 to 12 months after ACL reconstruction if you do appropriate physical therapy. So I got a 30 on me, said, have had multiple shoulder dislocations. Is there any other option besides surgery? I can't give you a specific answer to your question, but someone with multiple dislocations that occur easier and easier with limited trauma, I usually recommend surgery to fix that because that becomes very disruptive to your quality of life. And surgery is pretty straightforward for someone who does not have a lot of bone loss in their shoulder, but have tears in their stabilizing structures. So a labor and repair surgery is usually helpful for something like that. So I usually tell patients in that situation to get surgery if they've had multiple dislocations. So I'm going to skip around here. Ariana asks, can an X-ray detect ligament tears in the knee? I'm in tons of pain, but my X-ray is good. So X-rays cannot detect ligament tears in the knee directly. Ligament tears are diagnosed and seen with MRIs. MRIs allow us to see soft tissue structures better, which is what a ligament is. And so the answer is a ligament tear cannot be seen on X-ray. So CEO says, hey, doc, I dislocated my patella a week and a day ago. How big is the increase of it? I guess your question is, how likely is it to recur? So patella dislocations occur in a certain subset of people, especially people who have a lot of laxity in their joint, which means they have a lot of looseness in their joint. So it depends on how lax you are. I cannot tell you that obviously on the internet without examining you, but unless you have significant laxity, it can occur in a subset of people, sometimes 15 to 20%. I can't give you a specific answer on that, but the recurrence rate really has to do with the amount of disruption or the injury that you've had to the stabilizing structures of the knee. So usually for people who dislocate the first time of the patella, I send them to physical therapy and see if they can get their patella stabilized with physical therapy alone, unless there are other issues that are injured significantly during the initial dislocation. I usually send folks to physical therapy and some of them get better. I would say about 50% get better with physical therapy alone, then 50% require surgery in my practice. Siobhan asks, anything that can make frozen shoulder better or speed up the unbowing process? So that's a great question. Frozen shoulder, again, is a condition that affects women more than men, a lot of it because of hormonal imbalance, and usually happens in the 40s, but it does not necessarily have any ability to speed up. Sometimes with injections, it can help with the pain, and physical therapy can speed up the recovery process and allow the frozen shoulder to thaw out sooner than later. So good luck with that. Sorry about your condition. So Jason says, I have compartment syndrome. My entire leg goes numb when I run. How will this affect me later on? So compartment syndrome is basically a condition where the leg or whatever body part you are referring to has an increased pressure in the area, and that causes a compression of the nerves and vessels in that area. It can lead to numbness, tingling, and some changes in the blood flow. And if it is a chronic issue that affects your running or affects your sport, it can be treated with surgery to kind of release the compartment, and that can improve. So I would say in general, for people who have a lot of issues with compartment syndrome, that does not get better with physical therapy alone, a compartment release surgery is a good option to consider. So Owen Emmert asked, why do I keep feeling like a tendon is popping under my knee, even though I've had an MRI with no results? I can't tell you just by talking to you over the internet. So hope that issue gets resolved, or see another orthopedic surgeon for a answer about that. Just skipping around on these questions here. So Hector Alice asks, I have terrible pain on the inside of my elbow when I lift, and now it's when even pushing on stuff. Again, I can't tell you exactly what your diagnosis is, but in general, pain on the inside of your elbow is due to a sprain or injury to the flexor muscles around the elbow, or sometimes a ligament around the elbow. So it should be evaluated by an orthopedic surgeon to evaluate whether or not you have what we call flexor tendonitis or a UCL sprain. So those are two of the inner structures on the elbow that can be injured with lifting or any kind of repetitive motion there. So Steve Sanchez says, I have a medial meniscus tear. Any suggestions? So medial meniscus tears initially depends on how bad the meniscus tear is. If it is a mild tear or a tear that has been there for a while, sometimes physical therapy can help to give some support and some improvement in pain. And if the physical therapy doesn't help with that meniscus tear in terms of the pain, you can have surgery, a knee scope, which is a minor procedure to improve the pain and get you back to being healthy and active. Okay. So just skipping around here. So again, I'm a shoulder, hip, and knee doctor, so I'm not going to answer necessarily body part injuries other than those issues. So Carlem asks, how bad is runner's knee? So runner's knee is basically where the patella is affected and the patella is not smoothly gliding over the knee, and that can be affected in a lot of runners just because of the repetitive nature of it. And it can be improved significantly with physical therapy, and it's a very common cause of pain that can be well treated with physical therapy and not surgery. So, uh, so Tanner Vogel 620 asked, "Do you believe that turf is safer or more dangerous for football players regarding injuries?" So this is a great question. So there have been shown to be more injuries um, on turf versus grass. The really interesting thing is that the World Cup, which is coming to the U.S., they are mandating that most of these stadiums put grass in their stadiums because there have been studies that show that grass is less likely to have injuries for soccer players, lower extremity injuries as soccer players. But for turf on football, there is some evidence that knee injuries are more common in turf and foot injuries on turf than from grass. So there is a difference in turf and grass, but there are other studies that look at newer types of turf that may show that there might not be that big of a difference. So the data kind of can be mixed sometimes on that. Um, so I'm going to skip around here. Um, So Christopher K. Leon says chances of re-tearing the tricep after surgical repair, wrestling injury. Once it is repaired, and if it is a stable repair, there is a low chance of re-tear of a tendon injury such as a tricep. So I can't give you a percentage on that, but I would say less than 10% of a re-tear of a triceps. So Jesse Bittner said, I just had an arthroscopy on my meniscus. Will I gain my muscle back within a few months? Hard to know, but usually with physical therapy, you do well in terms of the recovery after a meniscus surgery. It may take about 6 to 8 weeks or so with the physical therapy to get back your strength and your activity level. So I would just say keep on working with physical therapy. And Jewel says, "Good afternoon. Would you recommend getting plates and screws removed if experiencing pain?" So plates and screws for fracture or for some kind of broken bone is usually what we use in orthopedic surgery. And sometimes these plates and screws can be prominent because they might be right below the surface of the skin. And for people who have pain over the plate or screw, and once the bone is healed, the plate and screws can be removed without a huge issue. Depends on how big the plate is and where the plate is. But usually, in general, I tell patients that if they have discomfort from the plate and screws, it can be removed. It's not often that we have to, but if it gets removed, it is not a huge issue in most cases. But thanks for the question. Um, so moving around here with these questions here. Um so Kalu Macaulay is saying swelling and kneeling on the knee after ACL hamstring reconstruction. Again, I can't tell you what exactly is happening without being without seeing you, but in general, if you have new onset of swelling after a knee surgery, that's something that should be checked out by your orthopedic surgeon. But swelling in general right after surgery is very common, especially in the first 3 to 4 weeks after an ACL surgery. So it depends on when the swelling is occurring. If it's new swelling, then that should be something that should be seen by your doctor. Um, so I am just moving around here. Caitlin Gray says, "What are the odds of surgery for untreated patella fracture?" So I don't know the question specifically what you're asking, but I guess you're saying what is the odds of a surgery improving a patella fracture after 9 months. So if you have a delay in terms of getting surgery after a fracture or a tear of a tendon, it really makes the surgery a little bit harder in terms of the ability to repair that damage or to reconstruct it. But it can be done. It just takes more effort and more dissection and kind of more of a bigger surgery. But if it is a painful issue that has not gone away despite all this time, it might be worthwhile to check it out and try to get surgery to fix it. But I can't give you an exact answer on a how successful it would be. So Jacob says, is hip flexor soreness normal after hip arthroscopy? So I would say anterior groin numbness, or sorry, anterior groin soreness is common after hip arthroscopy. I would say it would be hard for you to, in my opinion, really differentiate if your hip flexor is actually sore. What you're feeling is probably soreness in the front of the hip from the capsule, which gets open and closed during hip arthroscopy. So it may not necessarily be your hip flexor. It might just be a lot of structures around it, but that is definitely common after hip arthroscopy. Okay, I'm just going to move around here. So Morgan Roseman says, I'm a long distance runner. My left knee is increasing in pain recently. Again, I can't really give you a diagnosis on that without seeing you, but distance runners in general usually have what we call patellofemoral syndrome or runner's knee, which is a increase of pressure on the front of the knee from the patella. Usually can be treated with physical therapy and activity modification. But if pain is something that occurs that is not just related to running, like if you have pain just walking, then that requires a more urgent follow-up with the orthopedic surgeon, because that could be related to a stress fracture or something more acute that needs to be addressed. So Jordan says, 4 months post Achilles pars bridge surgery, when do you think I'll be safe to start running again? 100%. So Achilles repair, really, it can take about 9 months for a lot of people to go back to their sports in full strength and full running and full sprinting. So I would say 4 months after surgery depends on your recovery status. It depends on how strong your legs are, how strong your single leg strength is, and if you're able to do 10 single leg strength. Sorry, if you're able to do 10 single leg squats, which is kind of my general in-office test for how strong someone's leg is before they run. That's kind of my barometer in terms of allowing patients to start attempting to run after, whether it's a knee injury or a lower extremity injury. If you could do 10 single leg squats without falling over or without too many balance abnormalities, then that's a good, really, indicator that you have good strength, that you can start jogging or doing some kind of running without an issue. But it takes a gradual process to do that. So just, again, I'm skipping around here. If I miss it, just send me a DM. So 8 months ago. So Ivan says, 8 months ago, I had ACL and meniscus surgery. My knee still pops and clicks a lot. Is it normal? So popping and clicking the knee is really normal, especially after surgery. It really is not anything that we get concerned about as orthopedic surgeons. The issue is whether or not the popping and clicking is painful. If it's not painful, we really do not have any concern about it. It just is kind of how the scar tissue is moving about in the knee, and it's nothing to be concerned about, and we kind of allow you to keep going. So Andrew says, osteochondral cartilage injury, my knee, 5 millimeters, pain. My ortho just says rest. What else can I do? So I do a lot of cartilage surgeries in knees. So I'm a cartilage restoration surgeon, and me personally, I'm a pretty aggressive surgeon in terms of osteochondral injuries. And I usually treat these osteochondral injuries with cartilage transplant, which is basically taking cartilage from one place in the knee and putting it in the other part of the knee, especially in a 5 millimeter defect, which is not very big. As these defects get bigger, then you have to decide on whether or not you want to do some other types of cartilage restoration procedures, like a cartilage transplant from a cadaver, or even a cartilage regrowth procedure like MACI, which is what we call it. And so personally, I'm a very aggressive doctor when it comes to osteochondral cartilage injuries, because that's a deep injury to the cartilage that cannot be repaired on its own. And that is my personal philosophy on cartilage injuries. So I had a question about April Cole said, I had a PAO 7 months ago, still struggling with pain. Thoughts on femoral retroversion? So April Cole, so thank you for the question. So that question refers to basically rearranging the hip to allow it to get more coverage for the socket, basically. So it sounds like her socket was a little bit shallow, which is a hip socket. And the issue now is she might be having some pain. I'm sorry about your pain. And so the I guess the question is about femoral retroversion. So you're asking about how the femur is angled. And then so, I think that unless the soft tissue structures are also involved, I think some pain might be expected, but it should improve over at least the next several weeks, hopefully. Hopefully that answers some of your questions there. I'm going to skip around here. Hannah says, I had a capsular shift shoulder surgery in December. Is it bad if I still don't have full range of motion? So December is about 5 months ago. In general, I'd say it depends on how bad your shoulder was in terms of the necessity to stabilize it. So capsular shift surgery basically refers to a surgery in which you stabilize the shoulder by basically moving tissue to give it more of a bumper around the socket. And by essence, the shoulder gets stiffer. So if there was a big shift and a big surgery, then it might require some stiffening of the shoulder that might not necessarily come back easily. And so it kind of depends on how big the shift was and how bad your shoulder instability was beforehand. But I would say typically by 6 to 8 months or so, I would really experience, and I would basically expect to see almost full range of motion to the extent that you are doing regular things by that amount of time. So Xavier Cole keeps asking, sorry to miss this question, crush injury of the foot resulting compartment syndrome, Liz Frank repair. So I'm not a foot surgeon. I cannot give you specific answers about this injury. I know Liz Frank injury is a very severe injury to the foot ligaments, and compartment syndrome in general is a severe injury to a extremity. So it depends on the amount of nerve damage and the amount of muscular injury. So that is kind of the outlook for any kind of severe crush injury in general. It's the nerve injury and resulting muscle activity. So Daniel says, I had an ankle fracture dislocation. Can I avoid ankle arthritis? And I would say, unfortunately, once you have an ankle fracture dislocation, you will definitely have arthritis, unfortunately, because the injury basically causes damage to the ankle joint. It doesn't necessarily mean you need any kind of severe ankle procedure other than the surgery, but once you have such a high energy injury to the ankle, like an ankle fracture dislocation, you almost always have some kind of arthritis in the joint. It may not be symptomatic, but you will have, by definition, some arthritis if you get x-rays far into the future. Tony Rodrigo says, what happens if a specialist at an ER tells you that they'll treat you with a specific medication? I don't know. I'm not an ER doctor. Sorry. Ale says, how do I know my labrum tear needs surgery? Depends on what labrum you're talking about. So there's a shoulder labrum and a hip labrum. So they both give stability to the joints. And typically with a labrum tear, you try to do physical therapy to see if that gets better. And if physical therapy is not helping it, then you elect to do surgery. So usually, I mean, the process is whether or not you have stability. First of all, if you have instability, then you most likely may need surgery. And then second of all, if you have pain that does not get better with physical therapy, that is pretty much an indication for a surgery. So LB says, how do you heal from an anterior labrum tear? So again, it's kind of the same answer, same question, just for the hip now or the shoulder. So same kind of question, same answer is physical therapy to see if it gets better. If not, surgery to fix it. And I'm going to skip around here. Abby says, partially torn my patella tendon. I just missed it. Sorry. So it sounds like you partially torn your patella tendon recently. So partially torn patella tendon. I would say just get physical therapy. If it doesn't get better in general, I would say uh, surgery to fix the torn tendon because that doesn't necessarily get back on its own. Barnes Nobly, best treatment for tennis elbow. Tennis elbow should be treated with physical therapy. I think that it is a very long process, unfortunately, and some people do not like that it's a very long physical therapy and a long treatment process. But physical therapy has been the gold standard for tennis elbow. Sometimes PRP shots can help some pain relief, but physical therapy in general is the treatment of choice for that. Um, I'm going to skip around here. So, uh, anything, what about patella tendonitis? So, Lauren Smith says, what about patella tendonitis? Doctors say it's worst they've ever seen. I've had PRP, tenotomy. So, again, I can't give you a specific answer about your particular case, but in my experience with people with really bad patella tendonitis, if I get an MRI and it shows that there might be some degree of tearing of the patella, sometimes a very easy or straightforward operation where you basically shave the torn part arthroscopically can help in those kind of hard to heal cases like that. Let me see. I'm going to skip around here. Naya 2X says, if I get ACL surgery this month, will I be back to playing sport in October or November? So again, my philosophy on ACL recovery is 9 months at the very least, unless the patient and athlete are doing extraordinarily well, which is possible but not very probable. 9 months is pretty much the average time I recommend to going back to your sport. So unfortunately, that would be cutting it very close if you have it now and expect to be back in November. Um, so yeah, Marty asks, is RICE still recommended? So RICE stands for rest, ice, compression, elevation. And that's usually what people tell people who get injured to try to get some pain relief initially. And a lot of people sort of move away from that because there is a thinking that the inflammatory cascade, which is where the swelling occurs from, is actually helpful because inflammation actually brings healing elements. So the ice part of it actually decreases inflammation, which may decrease the amount of healing elements that go to the injured body part. So some people actually do not recommend ice initially and basically want a little bit of rest and then start using that joint to minimize stiffness. So I actually ascribe to some of that in terms of the healing part of it. Sorry for the loud thing. There's a lot of vacuuming going on right now, but I actually ascribe to that, the icing part of it, because for the inflammation, I think some of it is good and it's not necessarily a bad thing. But for pain, icing is still very helpful. So if you have pain, like after surgery, and you really need some relief, icing definitely helps to prevent that pain that you have. So Kaden Olson says, I fractured my medial malleolus, been taking very good care of it. How long will recovery take? So it depends on the treatment plan. So if you had a minor fracture that did not require surgery, it just requires probably a 6 to 8 week immobilization in the boot, non-weight bearing, depends on kind of how bad the fracture is. If it was fixed with surgery, kind of same amount of time to take the weight off of it. But in general, I would say bones take 6 to 8 weeks to heal and then another 6 to 8 weeks to strengthen it. So usually about 3 months is really kind of average. So Issa asked, why does my knee feel squeaky when I bend it? So a lot of people have popping and cracking in their knees when they bend and move their knee or squat or kneel down, and that really is not a problem. And I'm going to say this a lot because I get this question all the time from patients in my office who come into my office without pain in their knee And their only issue is that they have cracking in their knees when they bend it. And that really is not anything to be concerned about. It just has to do with the fact that the patella or the kneecap is not tracking properly in the knee. And that could be treated very well with physical therapy to strengthen the muscles around the knee. So it's not a problem. It's just patella tracking that is not occurring well. So so thanks, Jerry, for saying crepitus is normal as long as it's not painful. That's exactly what I mean. Appreciate it. So Eric Dalbinspec said, do you do any kind of MACI or cartilage procedure in the glenohumeral joint? So that's a great question. I do not frequently do any of those cartilage procedures in the glenohumeral joint for a couple of reasons. A lot of them are not FDA approved in the shoulder, and a lot of that has to do with the studies have not really been shown to do a lot of difference in that shoulder, in the shoulder joint, and there just are not enough patients to kind of have great studies on that. That's pretty much why. But for people who need it for some kind of cartilage procedure in the shoulder, I think there is a role for some small procedures like a microfracture, but some of those big cartilage procedures may not necessarily be done with a lot of frequency in the shoulder. I'm going to move around. Gina asked, where did you do your undergrad and what medical school did I go to? So I went to Yale University undergrad and Harvard for medical school. AK said, I just had a clavicle fracture, open reduction drug fixation. Am I going to die? So glad you had the surgery. Good luck on the recovery. Sorry about the injury. My clavicle fracture fixation for a broken clavicle is a very successful surgery, and it can improve your function very quickly. So the nice thing about the clavicle fracture and the recovery is that it happens very quickly, and you get your shoulder function within 6 weeks in general, is what I would say. Rose Knit says, I have PVNS. I was advised physical therapy or get surgery like every 10 years. What do you suggest? So that's a great question. So PVNS refers to I forget the first two words, but it's a nodular synovitis, which is basically an overgrowth of this tissue that takes over usually the knee, and it can cause pain and a lot of bleeding in the knee. And so pigmented villonodular synovitis that's what PVNS stands for. Pigmented villonodular synovitis. So PVNS basically takes over the knee, and it can cause bleeding and pain in the knee. And a problem with it is when you take it out, it can recur quite frequently or quite often. And so what is recommended that it be taken completely out. And sometimes there are some what we call adjuvant therapies, so medications that you can take to decrease the chance of recurrence. And they have found that sometimes you can do localized radiation treatment to the areas to decrease the chance of recurrence. So I've had to treat PVNS in folks before, and I think the main thing is that you have to do a very thorough dissection of the tumor. It is a tumor. It is a benign tumor. It's not necessarily cancer, but it is a benign tumor. Let me see here. So Rosemary Otter says, if I have a high-grade partial tear in my ACL, do I need surgery to play soccer? So it depends on how stable your knee is. If you feel like you have a lot of pain or instability is mostly the issue. If you have instability, then the necessity for surgery is probably helpful to play in a sport, especially if it's a high competitive sport like soccer. So it depends on how unstable you feel. But in terms of ACL surgery, I often do ACL repairs for people who have partial tears like that, and ACL repairs rather than reconstruction have been shown to do well as long as you're not necessarily doing a very, very high competitive sport. So there is some options there. So I'm just going to skip around. If I missed your question, just send me a DM. Thank you. TT, do you need a model? Katrina has volunteered for Leah. Thanks for that comment. So Phi says, I have a slap tear caused by tennis. Can it heal back naturally? So the answer quickly is no. Slap tears do not repair on their own by, unfortunately. The pain can improve. And so the best way to improve pain with a slap tear is with physical therapy. And so physical therapy does not necessarily heal the tear, but it can improve the pain and improve the stability and get you back to playing your sport. If you can't get back to playing tennis, then physical therapy would be the last resort before a surgery to fix it. And I'm going to move around here. So Adam says, how do I prevent stress fractures as a distance runner? I run up to 90 miles per week. Wow, it's a high amount of miles. So stress fractures happen with overuse injuries, especially in distance runners. And the best way to prevent the stress fracture, in my opinion, is basically to have great nutrition and great stretching and taking time off and resting and listening to your body in general. But I would say having great nutrition, especially making sure your calcium intake and multivitamin use is appropriate for your age group, and having well-fitted running shoes, especially that do not cause any issues there. But as long as you gradually work up to it, and your body can accommodate, your bones actually get stronger as you do a lot of impact activity. So as long as you work your way into it and you're not necessarily jumping up to high distances very quickly, if you gradually work into it and you are really working on a gradual increase in mileage, stress fractures don't usually happen when you are gradually and very deliberately working on your mileage. So that's one way to prevent it. Matt says, have you ever heard of VersaWrap? So yes, I've heard of VersaWrap. It's actually a material that you can wrap around tendons and ligaments and nerves and helps to prevent scarring after surgery. Emily Fleming says, how do I prevent another shoulder labrum tear after having it repaired twice? So sorry about your multiple surgeries there. And I would say that labrum repair surgery, if it fails more than once, then it is possible that there might be more happening than just the labrum. So the labrum is a soft tissue structure. And if multiple repairs are necessary, then it might be that there's some bony injury or bony issue that needs to be addressed. So I would say make sure your orthopedic surgeon or whoever's taking care of you tell you about any possible bony issues. I have about 2 minutes left here, so if I don't get your question, just send me a DM. So Bassett 505 says, positive Lockman and anterior drawer. Could the doctor be wrong waiting on MRI? So that refers to the clinical findings of an ACL tear. And unfortunately, having a positive Lockman, which is one of the maneuvers that we do on the knee, and an anterior drawer with someone who has a typical ACL injury story, such as someone who's running, they pivot and their knee gives out and they feel a pop and have swelling. Having all those things is pretty indicative of an ACL tear. So I'm sorry if that is your situation, and I hope that the MRI tells us otherwise. Jake Martin says, had a glenoid repair on the right shoulder 5 years ago, now have pain again. I am assuming you mean you had a labrum repair on your shoulder. It depends on what pain you have. So sometimes pain in the shoulder after a labrum surgery can be some early arthritis, actually, if there is not instability, meaning that your shoulder is not dislocating. So people who have labrum tear and have pain years afterwards can have the pain from a arthritis have happen a few years later. So I have one more question to answer before I go. So who has one question you want me to answer? Quick, one last question. So Eric, I think you asked this question before. I'll answer now. Eric Albanspec, what alpha angle do you consider surgery in FAI? So FAI is for femoral acetabular impingement, which is hip pain in people who do not have arthritis. Alpha angle is basically the measurement of how much impingement that you have. I consider 65 degrees as an alpha angle positive for surgery. And last question that I'm going to answer is I was told to have torn my ACL completely and need a surgery, but I don't want that. So again, ACL surgery is for people who have instability after tearing the ACL, which is the primary stabilizer of the knee. If you feel like your knee is unstable and you can't play sports and can't really return to your desired activities, I recommend ACL surgery. It's a very common procedure that sports surgeons do. And that is what I would recommend in general for someone with that issue. So thanks again. I have to go. I appreciate everyone for tuning in. If I missed your comment or question, please send me a DM or comment on my page. And thanks a lot for tuning in. Bye.